Good morning, everyone. I'm very sorry that I need to address you virtually at this meeting. I hope you really had a good time yesterday and good presentations, but I hear that the social program was also very good, and that's a perfect opportunity always to meet the people. I regret not being able to meet all of you in person this time. I look forward to seeing you maybe in Sydney or perhaps on another occasion. I was unfortunately stopped to be with you in person. I have to say, out of all my FDI travels this year, Portorož was the one I was really looking forward to. I have family ties with Šmarje and with Slovenia, and I was really looking forward to, but what can we do? I was stopped. Before I start, I would really like to thank for the opportunity and also to pass my apologies for not being there to Slovensko zdravniško društvo. So hello everyone, hello to all participants. Special greetings from everyone at the FDI, to Primarius Matej Leskošek. He's well known in our organization as a man who dedicated not only his career, but I believe also the big part of his life to education and to prevention. And we all appreciate the prevention very much. We believe it's the key to healthy lives. On behalf of my colleagues in the FDI, we have special greetings to Dr. Barbara Artnik and to Dr. Joanna Blatnik, because we work with them on a daily basis on all the things and aspects of the membership. My name is Djerdana Ivošević. I worked in FDI since 2006, so that's some 17 years now. In May I turned, and initially I was working on the projects. I was running some 42 projects in 40 countries, and for that particular reason, Slovenian Dental Association is a star association in my book, because I know what kind of prevention programs and prevention you are conducting. Right now, my role is governance and membership director, and I go a little bit more deeper in the General Assembly and the politics of FDI and the policy statements. A couple of words, just maybe for your participants, if they're not aware about everything in the FDI before I go with the topic of my presentation. The FDI is a French acronym, World Dental Federation, founded in 1900 in Paris, and it's one of the oldest international health professional organizations in the world. I would also like to add here that not only that we are one of the oldest international health professional organizations in the world, but we still hold the biggest medical congress, and I'm saying medical on purpose, because our congresses, they involve the business meetings, parliament program, general assembly, massive exhibition, and scientific program, and there is also media. So many congresses focus only on science, and many congresses focus only on the exhibition. We have everything under one roof, and we are hoping this year in Sydney, it's going to be the first time we are coming back in full capacity since 2019, when the Congress was last held in San Francisco. We did have parliament meetings last year in Geneva, but to be all back into one massive event, this is going to be Sydney this September, and we hope to see you there. We are governed by the General Assembly, and members of the our members associations are actually electing the FDI Council, and the Council is administrative authority of the FDI. But the strategy, the policy, and everything that FDI can put the name behind, including the policy statements, it's signed off by the General Assembly. We are made up of, it's a little bit more than 193. I think we are close to 200 national dental association, and that means the main representative of the dentistries in the countries. And we also have a specialist groups in some 136 countries. And we represent over 1 million dentists worldwide. I have to say we are now revising our strategy, which is going to be one of the agenda items for the General Assembly this year. And I did a count, and yes, we do represent well over 1 million dentists worldwide. And when we say represent, where we do represent them, We are NGO, a non-governmental organization. We are not international organization. We are head office located in Geneva, and that's ideal for interaction with all the international health organizations. And this is where we represent the dental profession. We are in the official relationship with the United Nations and the World Health Organization. We are founding member of the World Health Professions Alliance, and we are also a member of the NCD Alliance. And we work with them quite closely over the past few years because we are going a little bit deeper in the policy change on the local level. That is the only way, aside from all the prevention programs and education that we are doing. Vision and mission, couple of words: leading the world to optimal oral health. That is our goal. We had some discussion what the optimal is, and I think we all agree that the optimal is the right word. Mission, World Dental Federation, global voice of the dental profession, works with its member organization to improve the oral health of people worldwide. And here I think the key word is that we are not working anything without our member organizations. So we appreciate all our members. And again, Slovenian Dental Association. The General Assembly, as mentioned, it's the supreme legislative and governing body of the FDI. We have the annual meetings during the World Dental Congress. Last year was an exception. We only had the General Assembly meeting, and Slovenian Dental Association is a regular member with full voting rights, but I had to add that they are award-winning. And I was lucky to receive some of the images of the same action that took place a couple of days ago, and that is the action that actually was awarded. I have to say that the competition amongst almost 200 national dental associations is not easy, but on the year when Slovenian Dental Association was awarded was really something about the project that can be implemented almost in every part of the world, and it was something outstanding. So thank you for that. We have council committees, special committees, standing committees, all different spheres of activity: dental practice, education, public health, science, and membership. Regional organizations, European Regional Organization is highlighted here because Slovenian Dental Association is a member, I believe, of the European Regional Organization. We also have some sections: Chief Dental Officers, Dental Public Health Section, commonly known as Military Section, Defense Forces Dental Services, and Women Dentists Worldwide Section. And I'm putting them here out just to let you know that you can get involved. The associations are involved in the FDI, in the General Assembly, and with regional organizations. But on the three sections that are highlighted here, individual members of our member association can join and contribute and get involved. Of course, unless there is any objection by our member, which almost is never the case. I would also like to remind everyone that we have International Dental Journal, that it's actually free access journal for the past 2 or 3 years. And my contact details will be available. So if you're interested to receive, we have commentaries, we have amazing articles from all around the world. And who knows, maybe you would like to submit an article. It's a free access, and anyone can read what we published every 3 months. It comes out, I believe, 4 times a year, and plus we have some sections and commentaries and special editions. Main focus, member support. Of course, if without our members, we do not exist. So we have continuing education programs and some 30 events per year in 25 countries. We are expanding that. I think this year we're going to go to 40 something. We give advice and support for the development of National Dental Association, governance, membership. That is particularly my area. Then there are policy statements highlighted here because that's going to be the topic. We produce different guidelines and toolkits, and also a lot of white papers chair-side guides that are often translated into many languages. So this could be something very useful for your practices. And of course, everything is on the FDI resource page. Everything is free to download. And I think that many of that, depending on the topic, because we are covering almost all topics, it's going to be of big interest to you. World Dental Congress, I already mentioned, Parliament, more than 350 representatives, scientific program, we have around 100 sessions, and the exhibition is quite big. World Oral Health Day, I believe that somewhere around here, we can also find World Oral Health Day in Slovenian language. I'm pretty sure. It's just the text is very, very small. The logo, and it's translated in many languages, and Slovenian is one of them, considering that the association in Slovenia is very active. We come to the policy statements. The policy statements are published in a way to help our association to lobby, and I don't like that word lobby, but it's actually lobbying and advocacy at the local level. And it's related to all aspects of oral health, and sometimes we go a little bit further than that, depending on the topic. You will hear later what we are doing about the sugar. Very much has put into antimicrobial resistance over the past 2 years. And our policy statements do not just come up like that. They're put together through a consultation that lasts 110, 115 days, with the involvement from the feedback from the National Dental Association, experts groups, and only once everyone is happy with every single word, then we put it up for a vote. So they are thoroughly revised before we present them to General Assembly. So it goes proposal and adoption, technical work by the standing committees, national dental associations, they comment and send amendments. Then we have a voting process. And if everything goes well, then we have a final adoption. And then after the adoption, the policy statements are published on the FDI website. I will have to repeat here again that many of the resources that we have are, of course, free of charge for download. And we also send them by email to all national liaison officers, which is one main contact in every association in charge for good relation with FDI. You can also, if you go on the website, you can find them on the keyword, you can find them on the topic, you can find them on the year. And we did revision of the website and made sure that it's actually easy to use. So even if you have a look at different topics, I think you might find a material that's going to be of interest to you, either for your work or your academic work or for your dental practice. What happens next, ideally, is that we forward the policy statements to the members and they forward it to the board. And then ideally, there would be a short summary of the newly adopted policy statements, because when you speak to the ministries, when you speak to your legislators, nobody will read the 2-page document. A short summary would be an ideal way to approach them and to say something big is coming out and something big needs attention. It's always good to email the policy statements to all your members and insert a reference to the FDI, attach the original, and actually involve them that we exist and not the material that it's there, or publish them on your website. Of course, you can put it on the discussion page, you can put it on your social media, you can create posts on social media for people to check out policy statements. I have seen some now being posted on Instagram. So they're there, they belong to members, they're developed by members, and they're there to serve you. And the ideal is for them to be used in the legislation. As soon as we put something, a topic that is of high importance, that means that we basically would like to have something done at the local level for the benefit of the population. So we warmly advise everyone to approach the legislators, who are lobbying to draft the national laws using these policy statements. I think it's using them as a reference is the best way in drafting national legislation. It's not only that they were used for drafting national legislations, they were a couple of times also used to draft a national health plan, not only oral health plan, but health plan, because many of the countries, and I will just get an example, it was Sierra Leone, these documents were used for that. So this is a massive resource that exists at your disposal. You can also leverage your own status of National Dental Association board member to bring the policy statement to discussion on the national level. And the word target, it's like people to focus on. It's the health minister, Ministry of Health, congressman if applicable, anyone who have interest in health, lawmakers, or anyone who have interest in health. We had just now, this February, we had an interesting approach from the US Congress. And first we all thought it's a spam, but actually no, it was a person who is very committed to oral health. He's a dentist, he's sitting in the US Congress, and he wanted us to support their idea and their wish to celebrate the 20th of March together with most of the world now, considering our successful campaign, all of that to raise awareness about the oral health. So that is still work in progress, they're slow, but we were surprised how far our documents reached into political levels. They're very useful when it comes to hot topics. And just as a reminder, back in 2015, WHO released guidelines for sugar intake for adults and for the children. So every single time, well, most of the times when WHO is working on a guidelines or anything that it's involving oral health and oral care, FDI is consulted. And of course, we very often share that consultation paper with all our members. We are calling for comments, we collate the comments, we use our experts as well, and we contribute to that. So the guidelines that was there was thoroughly revised by FDI as well. So we responded and we favored the recommendations, and we followed by issuing a policy statement on dietary-free sugars and dental caries later that year. And then we produced the practical guidelines shortly after on sugars and dental caries. And that was the practical guidelines to reduce sugar consumption and curb the epidemic of dental caries. Which brings me to something that I think we are all starting and to agree more and more. That sugar is very often seen as new tobacco. And here I'm going to share with you the success story of the policy statement implementation conducted by your fellow member, New Zealand Dental Association. So when that guidelines got out from the WHO and when FDI issued the policy statement, the first thing that New Zealand Dental Association did is to make a consensus statement and to publish it wherever they could. They focused on the sugary drinks. They actually identified that to be the main problem in schools. And as you can see, they involved not only their association, but it was Cancer Society, the Diabetes Society, all the NCD groups, Heart Foundation, and the local councils, which is the way of leadership in New Zealand. I think they did push hard. And they presented some facts. I'm not sure if this is the case, considering that Slovenia has such a good prevention program, but this is what was happening in New Zealand Dental Association. They said that every day they were taking out teeth like this from kids in their local hospitals. And World Health Organization gave some recommendation, and it was for children, it was a maximum for adults. And there is always a question on how much is too much, basically. And I think one of the usual suspects is the strong marketing from the company that you will recognize. I'm not willing to say their name, but just to give you an idea, this is their truck leaving the school because they were in the machines where kids could pick up the drinks, etc., etc. So I have to say that the New Zealand Dental Association not only went into strong lobbying with the ministries, but in a way, I think they entered the war against sugary drinks. And on the right side, you're going to see the image written Coke by the tooth extracted. So how did they did it? They did target leaders and they presented only the strong facts. They kept it very clear and concise, which brings me back to the point on the policy statements, which is 2 pages. We limited it to 2 pages, but it can easily go to 3 pages. It needs to be short to get attention. They were clear in speaking out. They used the media. They, if they didn't have resources in-house, they found a way how to correctly use the media and present the problem. And they were doing all of that in small steps. And I think that the key word was patience, because this was a process that started back, if I remember correctly, back in 2006, the fight against the sugar in New Zealand. But this is how they used the resources and everything that got out to finally reach the goal. They had a sugar consensus status, putting sugar icon on the drinks and everything that was to be consumed in schools. They had a thorough look into food marketing to children and what was actually targeted to children in the commercials and how it was done. They adopted WHO limited guidelines on sugar and encouraged the public to switch to water instead of sugary and fizzy drinks. And they came to a couple of things which I personally admire, which is water-only policies in schools and water-only policies at council. So that means they, in a way, led by example and helped levy on sugary drinks. Aside from that, they did a lot of, let's say, it's almost like a sort of prevention program. There was Adopt a School. They were supporting school to become a water-only school. So what they did with their members, New Zealand Dental Association dentists, they were encouraged by New Zealand Dental Association to adopt a local school and to actively promote drinking water, limiting it to milk and the water as only options at school, enabling students to access water readily at school. They didn't allow students to bring sugary drinks to school, which is also a very, very interesting approach and very, very strong statement. And they were ensuring that sports teams use only water as a source of hydration. Of course, they were ensuring staff commitment to role model this option while at school. So that means that this would apply to teachers, it would apply to dentists, to doctors, and to everyone else. So again, lead by example. This is Professor Robbie Beaglehall. He's an expert in what he's doing. He's fighting the sugar for many, many years back. He was the main author and one of the co-authors of FDI Oral Health Atlas that you can find on the website. And we targeted that problem back in 2006 when we compared how many spoons of sugar is in Coca-Cola, but also how many spoons of sugar is in Tropicana orange juice. So as you can see, he's standing right next to his winning poster where a hospital banned sugary drinks on their premises. And this is also from the media, that are hasting councillors to say no to fizzy drinks. So basically, they all council offices and facilities, which is similar to municipalities and in their different regions. They voted off the menu to have Coca-Cola. And I don't know if you know, at our congresses, I don't think, well, in parliament, there was certainly no Coca-Cola. But I think the last time we had it was in San Francisco. It was difficult to avoid Coca-Cola in the United States, but we are trying to get it off the menu completely. All fizzy drinks. I'm not going to go focus only on one. For everything that they did, they won the Dental Association International Prize for the water-only schools. And not to mention the removal of the sugar contributing factor to not only caries, but many, many nasty diseases. It's all about the hydration. So I'm glad that they won this award because they really deserved it. And the same manner I promote Slovenian Dental Association, how they put their prevention in place, the same way New Zealand Dental Association can be a role model for the way they put some healthy habits in schools. So what did the association do to support their members? It was not only go and lobby for us. They provided a toolkit for all the dentists to approach the schools. And in this case, I think in New Zealand, the dentists are doing the tours in the schools and doing evaluation and checking dental checkups, etc. So they prepared everything for them. They prepared the toolkit, they prepared the PowerPoint presentation with the facts, letter of template, policy statement, posters, pamphlets, list available resources, key messages, media release templates for policy launch, similar to what we do for World Oral Health Day, but this was really to fight sugar only. And of course, they always had at hand ongoing support and guidance from senior oral health educator, in their case, in Slovenian case, that I believe it's going to be the dentist. And I believe this is something what they put to actually make school proud. If it's water-only school, they're happy to share all of this information. And I believe that the schools took pride in that, considering that this happened a couple of years ago, and it's actually advancing and advancing and advancing. So it might happen then in New Zealand, as I speak, most of the schools, if not all, are water-only school. And of course, they invested into having the water fountains to make sure that kids do not need to look for something else. But they went beyond. PR is a very important part of it. They actually use the athletes, they use the school athletes, the school programs as role models, and ask people to make a challenge to switch to water. And then case studies, this is interesting. You can see that 6 out of the 7 shops near their facility and that school, they agreed not to sell junk food to children in schools' uniforms after the student council asked them not to. So it might be difficult in countries where kids do not wear the uniforms. However, from my experience, usually the shops around, they know who are the school kids. And it was, in a way, overwhelming support by the, let's say, community next to them, that they just accepted to waive that income and that profit for the health benefits of the kids. So in this case, I think we cannot, we need to believe in people around. They wish good to the children and capitalize on that. Involving society and not only professionals, it's always the best way. Another college and the local supermarket, they joined to fight the obesity together and to promote healthy eating and to stop the students consuming sugary drinks and snacks during school time. As you can see here, very often in supermarkets and still in Switzerland, you can see there are options of the sandwich and the sugary drink. And here they're putting, and it's at the promotional price. I'm pretty sure you can find it everywhere, starting from gas station to supermarkets. But what they did is put the healthy snacks and water at the preferred price. And then Dr. Bigahol, that I mentioned before, he keeps on fighting his fight for the sugar taxation, and he's actually alerting people that the dangers of sugar has not worked. We all know, as we all know, that tobacco consumption is a killing habit, but still many people that know that, they're still consuming it. And Dr. Bihol believes that the same thing is happening with the sugar as well. So he's doing a massive work that I cannot sum up in presentation here in 10 minutes, but if there is any interest, if there is any template that you would like to use, and I would like to see that in Slovenia as one of the countries that it's the most advanced, well, I can almost say in Europe, considering that I know how many countries have school programs. I think this would be a logical next step for the youth in Slovenia. And if none of that works, it's always good to bring to the legislators the cost of diseases. As you can see, the oral disease, the money that it's spent on curing that, it's not far away from many other terrible diseases that we talk much about. So this is a good slide to use to remind the legislators to just check on how much is spent on the treatment and comparing to the prevention. Recently, just a couple of months ago, WHO issued the World Oral Status Report, and it indicates for every country all the details that are relevant to our health. And following that, couple of let's say months later, they produced the oral healthcare in Europe. So their idea now, when the data were collected for all the countries, is to do them regionally. So this is just for information. They're obviously saying that there is a summary, a short saying there is a need to better integrate oral healthcare into primary care. And when we talk about that and the prevention programs, it's all clear. This definition didn't change, and it's unlikely to be changed. It's really beautifully summed up how much this is important, how much this is working. Your association knows that you have fantastic data on the prevention programs at work. However, I highlighted in red that oral hygiene advice and instruction and providing dietary advice is actually the key. Health in all policies. We start with the policy statement, and I don't know if I was going too fast on this, but we start with the policy statement and the ways that they can be summed up and used to be brought to the legislators. But it's easier said than done. The oral health in all policies, it's actually a major challenge for dental profession in 21st century. And it's not only for dental profession. If you want to have the health in all policies, it's a challenge. So there is a need for more effective engagement with politicians and with policymakers, and importance of enabling a social movement for our health is maybe it should be the second bullet point here, because just looking at the activities that Slovenian Dental Association did last week, that's how you get the attention. That's how you get the education of the population, and that's how you motivate the kids. We are moving now a little bit further. FDI is drafting the position on free sugars, and of course this is going to go to General Assembly. It's still in the draft, but considering how much your association is advanced, I decided to send this draft document first to the Slovenian Dental Association, because I trust in your expertise, I trust in your experience. When I say I think of FDI. This document is still going to pass some minor, we worked a lot on it, but it's going to pass some minor wording, and then it's going to be treated as a policy statement. It's going to be sent to all General Assembly, translated into languages so that people can really thoroughly revise it, add something if they need it. And this is going to be the first FDI position, not WHO, but FDI position. And I think that FDI as an organization, well, actually, I can tell you it's going to take more steps to do its best to limit the consumption of sugar and to put it on minimum, and to advocate to its members to try to stop it in schools, in workplaces. I will come to the next slide, but the point here that I wanted to raise is that this document was not seen by the members yet. You are the first group that sees this draft on a screen, apart from our council. We just initially approved the initial draft at the council meetings on the beginning of May. And this document is going to be sent by email tonight already, to be ready for the review by the Slovenian Dental Association before everyone else, because I know you have the expertise and I know you have the ideas. So just, this is a draft of what we are proposing: healthy schools, hospitals, and workplaces. And here, it's only part of the document. The document is about 3 pages. Here, these are some of the actions that we would like to see to raise awareness of the danger. Many of these comes from the success stories of our members. And we go beyond the dental practice. We go employee wellness programs, healthy habits, exercise, water only, raising awareness, not only with the kids, but raising awareness amongst parents, oral health literacy, preschools and schools, lessons. Again, many of this is already a standing activity of your association, but we hope you will appreciate the trust that we have in you to be the first association to review this document. And of course, you will review it again with the rest of the General Assembly. I will come back to health in all policies, and a definition that I think it sums up perfectly. It's an approach to public policies across sectors that systematically take into account the health and health system implications of decisions, seeks synergies, and avoid harmful health impacts to improve population health and health equity. So we are talking about harmful health impacts. And purposely, I took the sugar for the example for the policy statement. This, of course, can be used on antibiotics. It can be used on vaccines. It can be used on any other policy statement that you want. But I think that the sugar is something that it's the biggest danger these days, and hence it came as an example in this presentation. But of course, I hope you will use this as an idea on how can you change the legislation in your country for the better of your population, for better health of everyone. I purposely use this photo because you can see this is not something that just happened there. You can see that it's an action that it's already taking place. So the momentum is there. I see a lot of happy and healthy kids behind you. And I'm pretty sure that you can educate them even more on healthy diet and on the dangers of sugar. And looking at the group, I think they're ready for it, unless you're already doing so. And in that case, I wouldn't be surprised. But again, this was just an example of what can be done with the FDI policy statement. And my last slide. Najlepša hvala. I hope that I will be able next time to be with you. I hope to see you in the in FDI Congress in Sydney. And while I was corresponding to the team organizing your wonderful Congress, I received this great photo of the staff. I'm pretty sure everyone had a great time. And I just wish that I wasn't in that photo. So my personal wish, apart from wishing you all the success in all the work that you are doing, is to have an opportunity to be in that photo with you on another occasion together. I wish you all the best and enjoy the rest of the day. And I hope the presentation was informative. The association has my contact details. If you need any other resources, if you have any questions, we cannot do it now, but if you have any questions, please feel free to reach out to me. Lep pozdrav i najlepša hvala.